relatives, some direct members of the family. So this is not something that we're hypothesizing about it. It's not hypothetical. It's a reality that we are living in. And it's a reality that requires all of us to put every effort possible to make our own minimum contribution to ensure that we make a dent and ensure that we take off the wheels from this pandemic. Having said so, thank you very much. I don't know, I'll have to check Honorable Mailam. I don't want to do, I will hope I will do it at the right time. Before we closed, but after, if I'm not mistaken, our last meeting, we were notified that there is a change on the delegation of the Democratic Alliance with Mr. James Lorima being part of this committee. I wanted to welcome him when if he was part of this meeting, and say he's welcome to the committee. And I'm sure he's not new in the mineral space, and we look forward to him adding value to this. But please, Honorable Mailam, because you are in the house in this meeting, extend our appreciation to Honorable Phillips, and we appreciate the work that she has done as part of this committee. And we will always recognize the efforts that she has made to ensure that the committee continue to be vibrant, but also attend to every aspect that it is tasked to do. Without any further ado, as I've raised that when we deal with the revised program of the committee, we'll explain some of the issues that we think are critical. But we had to convene this meeting because we couldn't undertake some of the commitments we've made. And we said that we needed to squeeze in a very serious matter that we think we couldn't undertake some really of the commitments we've made. In fact, to put it forward, and we said that because it was part of the program of the committee. But the issue of the COVID-19 pandemic is a matter that we all have to take serious, and hence we had to bring that forward. And when we could get space, and we think that it is critical both for the industry, but also for the lawmakers, in this case the legislatures, in the context and in the form of parliament, as well as the executive authority that is tasked with ensuring that there's adherence, enforcement, and compliance with regulations and protocols. So when we are here today, honorable members, we have to look at the impact of this virus in terms of the productive sectors of our economy, in particular mining, as a very volatile and much more exposed sector in terms of its populace. So that is why we have invited the representative of the employers, a larger body of the employers in the mining industry, which is MINCOSA, as well as the department as a regulator, as well as a law enforcer and compliance agent, to be able to present us so that we can have a better picture of what is actually happening, and are we not heading for a disaster beyond just a pandemic, but also in terms of our socio-economic challenges. So that is why we have invited you, MINCOSA. I must say in advance, both yourselves and the department, we are a committee of parliament that wants accountability, but also at the same time, we we want to know where there are bottlenecks and where there are challenges, and so that we can be able as Parliament and specifically as a committee to make a determination on some of those areas on how best can we complement the good work that is being done, but also how to correct where we feel that not enough is being done in relation to the task of each individual. So on those bases, we think that you will be able to assist us, and also will be able to assist you where it is possible to advise, recommend, and complement what we think it is necessary to be done. And that is the reason that you are here today. Without any further ado, can I now check for the apologies? Are there any apologies?
Good morning, Chair, and thank you. The following apologies: Mr. Zingula, who's unable to attend the meeting this morning. And then we've also received an apology from the Minister of Mineral Resources and Energy, who's attending a cabinet meeting this morning, Chair. Those are the apologies received, Chair. Thank you.
Chair.
Hello.
Chairperson, Mr. Lorimer has asked that I make an apology on his behalf. He is going to try and connect, but he's traveling today. So he asked that I make an apology, and he will try and connect when he can.
Okay, thank you, sir. Having said so, we have the agenda in front of us, which will be the presentation by MINCOSA, and then we will then get a presentation by the Department of Mineral Resources and Energy. Mr. Rogers, you've got about 45 minutes, it's 15:15. Please return the robes to me you don't have to comply fully. You can, if you finish on time, thank you very much. But we'll give you up until 10 o'clock. The floor is yours. We will also introduce any of your delegation if you've got any. Some people are strong enough that they can represent themselves. The floor is yours, Mr. Baxter.
Honourable Chair, thank you very much, and good morning to you and to all the honourable members of the Portfolio Committee on Minerals, Resources and Energy. We appreciate the opportunity to come and present to you. I'll just make sure that I've observed all the right protocols. The Director General, Advocate Mokoena, is in the House. The Chief Inspector of Mines, David Msiza, is in the House, just to recognise them, and obviously all members. From the Minerals Council team side, we have Aubrey Ramawa, who's our parliamentary liaison, senior rep in Parliament. Dr. Tutula Balfour, who has played a significant leadership role in the Minerals Council in the battle against COVID, and she'll also be helping us with the presentation. She's our head of health. Mr. Sietse van der Woude is our senior executive responsible for modernization safety, and he's done a lot of work also in this area. Mr. Nick Lesufi, senior executive, also done a huge amount of work in this area, working with Dr. Balfour and the teams. And then Mr. Tebelo Chabana, senior executive in charge of our communications, public affairs, and also done a heck of a lot of work in terms of some of the initiatives that we've embarked on. So, Honourable Chairperson, just to get straight into the presentation, we are going to share with you the numbers. The Minerals Council website does have a daily update on our COVID cases, etc. And I'm going to hand over just very shortly to Dr. Balfour, or to Tule, as we call her. But I must say just a couple of introductory comments from myself. Firstly, it's exactly a year ago since this global pandemic, which emerged in February, was named as COVID-19. So it's exactly today that naming took place. The industry last year, through the Minerals Council and in collaboration with government, we started off in February by sending out to our members clear guidelines on how to handle a type of global pandemic. So we were already even starting to send out the information before the pandemic hit South Africa's shores. In March, we had taken a risk-based approach and developed a 10-point plan with both preventative and mitigating measures. In April, working with the DMRE and with the trade unions, we helped develop a set of standard operating procedures. A number of the ideas in that were incorporated into the gazetted guidelines by the Chief Inspector of Mines and the DMRE. We did a lot of work on looking at vulnerable populations and how to reduce the vulnerability, or at least keep people who are vulnerable not being exposed. We developed a set of field guides, did a lot of work in working with local and provincial government around sharing hospital facilities, making sure that all our systems were working in terms of making sure all the protocols were in place around PPE, sanitizing capability, social distancing where possible, and obviously doing the necessary to help with in local communities around the distribution of, the various preventative products like sanitizers, face masks, and then also delivering food parcels to many communities that were negatively affected, and even water in certain communities where water wasn't available. And so I think a very significant effort took place. We did have an oxygen initiative into the Eastern Cape to help the Eastern Cape hospitals with enough oxygen, and Tabelo can talk about that later if any questions come up. And we managed to get, by the end of last year, about 385,000 employees back into the sector, compared to a normal working population of about 450,000 workers in the sector, which is about an 85% return to work ratio, with 15% obviously staying at home because either they're vulnerable employees or couldn't get them back to work, due to various reasons. Production for the sector was down by 10%. We did see a slight improvement on the revenue side because of a weaker exchange rate and because of slightly higher commodity prices, and that's obviously been very helpful. You'll see that one of the significant contributors to Treasury, and it'll come out in the national budget later this month, has actually been the significant increased contribution of the mining sector to the fiscus through both royalties and through corporate taxes. But that can be a conversation for a slightly later stage. But I think what is important here, Honourable Chairperson and Honourable Members, is the significant cooperation that's taken place between all the stakeholders. And we'll get onto that. Through the entire pandemic, we've had a significant level of engagement with the DMRE through the Minister, the DG, the Chief Inspector of Mines, and we've worked as effectively as a team because this has been about saving lives and saving livelihoods. And we've managed to get the sector back to work at a quicker pace than many other sectors. I can just say that there's been significant cooperation from ourselves with other business associations, giving them guidance on how we've implemented our standard operating procedures so we can share lessons and guide them on preventative and mitigating controls. Many other sectors of the economy were not necessarily as well prepared as the mining sector, given our experience in managing the HIV/AIDS pandemic and obviously the TB pandemic. And so it was about May, June, when the Minister also engaged with us and the DG, on how do we revive the mining sector in the new normal, not post-COVID-19, because I don't think, Honourable Chairperson, there is going to be a post-COVID-19 period. I think this is much more about the new normal, where we've got to manage things in a very careful way. And I think the level of engagement has been very important. We've been looking at, what are the bottlenecks that are holding back not only mining projects, but also infrastructure-related projects on the electricity side. And I think that would be obviously of great interest to the Portfolio Committee, to the PPC. We've been looking at how do we revive exploration in the country. The Minister set a target of getting exploration back to 5% of global total. It's currently 1%, and getting mining back to 10% of GDP, where it's currently sitting at 8%. And so there's been a whole bunch of work about how we can work together on trying to unlock projects, processes, and otherwise, speed up licensing times, look at an exploration plan, et cetera, et cetera. I'm sure the DG will talk about these in a moment. And Honourable Chair, I think that's been a really important part. Our strong commitment and belief is that we can help in working in partnership, including with organised labour, to drive the agenda. My last comment before handing over to Dr. Balfour to give the full update, and then Nix Lesufi, and then I'll come back in at the end on the vaccine side, is just as an example on the vaccine side, we've already had 2 meetings with the full leadership of the trade unions that are the significant trade unions in the mining sector, as the Minerals Council, engaging with all of them. And we will be engaging with the Minister and the DG also fairly soon. And that's been because, this is not a competitive issue. This is a really important issue about saving lives, saving livelihoods, and particularly in how we look forward in terms of rolling out the vaccine. But I'll get into that equation in a moment. Without further ado, Honourable Chairperson, let me hand across to Tula, Dr. Balfour, and she can just give us and the committee a quick update on what's happening, and then some of the things that we've been working on over the more recent period. Tutula, across to you, please.
Thank you, CEO. Honourable Luzipo and the honourable members of Parliament and all senior officials, ladies and gentlemen, compliments of the new year. I'll now shut down my video. I'll just be going through the statistics for the disease from the beginning of the epidemic in March of last year. The number of workers we are looking at here who are back at work is about 382,905. And of those, in the whole time that we have had the epidemic, we have done 107,000 tests. And I need to note that a number of those tests actually were done at the beginning of this year. From when we closed, in fact, if we say our cutoff of about 15th of December, when some companies then start shutting down, and therefore from that time up until now, we have done 42,000 more tests than we had done in the previous year, where we had done about 65,000 tests. So here I'm just illustrating the fact that the companies seem to have gone on a serious testing campaign when workers came back. This had also been our advice, and I think also the DMRE had a similar view that we really need to do more testing. So there was more testing done. Out of that, we now sit with about 28,588 cases of COVID-19, and out of those, most are recovered. And I would say that we are following a similar trend to South Africa, really, where the epidemic now is coming down. As you remember, in South Africa, we actually hit about 20,000 cases at one point a day, versus in the last wave, where we had reached what we thought was a very high 14,000 cases a day. And so we are now in South Africa coming down to about 3,000 cases a day. And the same with the mining sector. We've had a massive reduction in the numbers of cases. And so the active cases we have are about 1,073. The deaths are not yet coming down. We are on 319 deaths. We had closed the year, if I say the 5th December, we're on about 200 deaths. And so I think it just illustrates the ferocity of the second wave in the country, and which we have also seen in the mining industry. We do anticipate that in about a week or two, they're now away, as it did with the first wave. You will also note on the previous slide that our testing rate is higher than the global rate. The rate is about 23%, and the global testing rate is about 19%, and the South African rate is about 14%. Of course, the South African rate is limited by the resources where it's targeted testing. It's not a more widespread testing. On the next slide, I think that's where you see just how high the second wave went. So during the first wave, I think the highest we went was about 600 cases in a day on average. And in this current epidemic, we did exceed that, probably more towards 700 cases. And I have also indicated that was the same with South Africa. Thank you. Following slide. Here it's just to illustrate the commodities. The top slide is the commodities and deaths in those commodities. Platinum, of course, has got the largest number of employees. About 180,000 employees are employed in the platinum sector. Gold is hovering around 110 employees, and coal, between 80 to 100,000. So it is expected that platinum would have the highest number of cases of the disease at about almost 11,000 of the cases, followed by gold and coal, or followed by actually the total other commodities, and then gold and coal. The number, the percentage deaths, however, tends to be higher in the gold sector compared to the platinum sector. The graph below shows you the geographic distribution, and Northwest is where the platinum mines are, and Mpumalanga has also got significant, it's all the mining provinces, let me put it like that. Northwest being the leading mining province with the highest number of employees, Mpumalanga and Limpopo, and then Gauteng, we still do have a bit of gold mining. The Northern Cape has significant numbers of employees, and also Free State, which is mainly gold. And the next slide. This is just showing you the positive cases per population and per test, and we compare the mining industry versus South Africa and globally. And as you can see, we have got very high percentages of positive cases per population. Therefore, when we test, we do find quite a significant number of people that are positive, whether it's per population or if it is per test, compared to South Africa and globally. And the right-hand graph shows the recovered cases and the deaths per positive case. And again, we are having the number of recovered cases fairly high. As you can see, South Africa is sitting on 92%, which is where we usually get to once the epidemic, is coming down. So even with ourselves, it is coming down. And the deaths per positive cases, we have a fatality rate of 1.12%, which is of those who had COVID, what percentage died. So we have done fairly well in terms of the percentage of people who died if we compare with the global stats, where it's about 2% of people who die, and in South Africa we are recording about 3% of people who have COVID do demise. Thank you. The next slide. Okay, this slide again, it's showing you the deaths where it's from the beginning, and it's illustrating the waves, the two waves that we saw. On the left, the first wave, and on the right, the second wave that we have had. The next slide, which is a further analysis of deaths, and is my last slide on analysis of our cases and deaths. We find that the distribution really, the cases we are analyzing here is as of the 29th of January, where we had 275 deaths. And there we still had females having about the same preponderance as their population, as represented in the population that they are in the industry, where we have about 12% to 13% of our population being female, and therefore the deaths, they accounted for about the same. The age at the top, the age, again, this is the distribution of deaths, and you will see that half of the deaths are in the people who are 50 to 59, followed by those who are 40 to 49. And if we had shown you a graph of the actual cases, you would have seen that actually the cases are higher in the more 35 to the 49-year-old age group. So again, underscoring the fact that the disease is more prevalent in, or younger people have the disease, but those who do die, it tends to be the older people. And on comorbidities, we also looked at, it does show the fact that of those where we knew who has a comorbidity, the average really is about 80% of the people who die, and we know whether they have or don't have comorbidities. You find that they do have comorbidities, which is again similar to what has been found in the country and the worldwide actually. And that's where the issue of vulnerable employees then came in, where companies needed to see how they limit and protect, or limit, exposure and protect those with comorbidities as much as possible. I'll now hand over to Mr. Lesufi. Thank you.
Good morning, Honorable Chair. Good morning, honorable members. Good morning to the DG and Chief Inspector and the senior management team at the DMRE. When we were preparing for the shutdown in December, we wrote to the Department of Health, the National Department of Health, proposing a plan, because we were worried that when the workers were going to go home, there's going to be a bit of congestions on the highways and the freeways, and there's going to be congestions on the major transport nodes, and there was going to be congestions at the border posts. And in preparation for that, we had discussions with the Department of Home Affairs and the Department of Health about a staggered lockdown. So what we did, we then agreed with members that members will not shut down their operations at the same time, and they will shut down through a phased process where workers will be released early and come early, like the classical case of last in, first out. So we managed to do that, but we did not succeed 100%, if I may put it that way, in terms of we encouraged some of the workers not to travel to some of the hotspots that have been identified. And then we had to arrange, self-help packs in terms of when they were going home for additional education and awareness, how to conduct themselves where they are, how to maintain the mitigative measures of preventing the spread of the virus. But there were also additional challenges in the sense that in the neighboring countries, the availability of facilities for PCR tests was a bit of a challenge. And also, even if they were there, the accreditation and the validity of such tests were still questionable. So we arranged with the Department of Health and the Department of Home Affairs, employees be, given a special offsite from the border, the ease of travel through the border, and there's no congestions and super spreader events being created by waiting. That process did not go as well as we thought, because there were still some congestions at the border post, but we acted fast by arranging transport to transport the workers from the border post to the mine areas. Workers were then tested again by the employers, and especially workers from the hotspots were tested with the antigen testing, the rapid antigen testing, and the positives were confirmed with the PCR test. And we believe that
our special board meetings on the 11th of January to actually consider national vaccination strategy is critical to combating the virus. It's in the public interest. It's a it's of national importance, and we want to play our role in helping government and organized labor, working in partnership with organized labor and government, to be able to roll out the vaccine. So we have agreement and a commitment from some very significant medical capability in the sector, obviously based on our experiences of the TB pandemic, and basically, given the significant focus on health and safety in the sector, we believe that we can potentially vaccinate between 60 to 80,000 people per day. Those are the preliminary numbers that we've got back from most of our members in terms of what their capability is. And so we think that it's possible for the sector to help vaccinate a workforce, the full workforce, and as much as 2.5 million community members, because it's very important that communities within the mining areas are also vaccinated to create the country level immunity that we require. And so we've been working very hard on taking that commitment through. Given the fact that the government is the sole procurer of the vaccines, we had been involved in a discussion as a whole, not just the mining sector, also contributing to the vaccine acquisition component. The National Treasury have indicated that given that this is a public good, that the vaccines will be procured by government through Treasury. They've made the funding available. But that doesn't mean that we can't, on a Tumamina basis, have individual companies contributing to the Solidarity Fund, which may help as we go forward, if there are any gaps or shortfalls. But a lot of our commitment, we estimate that vaccinating, 2 to 3 million people in communities and in the industry would be probably about a 300 to 400 million rand contribution just in terms of the logistics and getting this done, excluding the cost of the vaccines. So just illustrating our significant commitment to this issue. We have been engaging with government through the DMRE, into the Department of Health and others, on the concept of the vaccination sites being listed as points of care. A point of care is basically you can then facilitate the actual vaccination process taking place. We have also been requesting that mine workers, smelters, refineries, and the mine rescue services also should be listed as essential workers. We can't have too many gaps in the whole process. It's quite important to ensure that all mine workers, given the settings that we work within, are vaccinated as quickly as possible, and we are committed to playing that particular role. So there is currently registration underway of 1.5 million health workers. That's phase one. Mine workers are in the phase two process as essential workers, together with vulnerable groups and populations in congregate settings. And again, we've had a series of already 2 meetings this year with the trade unions, several meetings with the DMRE, and obviously we are working through Business for South Africa, which is a subset of Business Unity South Africa, to make sure that we have that sort of impact on logistics, giving ideas and making sure that our facilities are registered for the vaccine rollout, etc. And obviously when the vaccines are available, we'll certainly play our role. We reckon that we can do approximately 2.5 to 3 million people within 2.5 months, using the significant healthcare infrastructure and capacity that we have, as the sector. And that's a real commitment to, jointly fighting this pandemic together. Maybe the last comment to make there, just on the vaccine side, is that, we've got winter approaching. The longer the virus remains out at play, the quicker, the more widespread it is, the greater the chance of mutations developing, particularly different variants coming through. And that's clearly evident by the emergence of the South African variant, the Ken variant, the Brazilian variant, and in the last couple of days, a further variant being looked at in the UK. What's interesting, and again, I've learned this from the doctors, Tutula's been educating me from the doctor perspective, that we still got the same strain. It's the COVID-19 strain, just that the strain has different variants. The vaccines are still effective against this particular strain that we have. The challenge comes in is if the strain jumps to another strain, where the vaccines may not be as impactful. But with this current strain, even with the different variants, in our view, an urgent vaccination strategy will certainly continue to work and prevent serious illness, from taking place, which is one of the key drivers of it. But also what it does is help numb down the spreading of the virus and the potential mutations. So we think the vaccine rollout is critically important. So Honourable Chairperson, Honourable Members, DG, Chief Inspector of Mines, just to say we are getting past the second wave. We think vaccinations are a critical component. Government fully agrees, the unions agree. All of us want to play our role. The key is obviously getting access to effective vaccines for what we need. We do have the risk of a third wave, and I think that's really an important issue we need to think about. And that severity will depend on the immunity achieved and how quickly we can roll out the vaccines, over the next, at least the next 6 months. But in the meantime, we are just stressing consistently, continually, the importance of maintaining social distancing, maintaining all the preventative measures, social distancing, where possible, the use of proper PPE when you have incongruent settings, making sure that sanitizing takes place, making sure that we're doing all the necessary preventative controls in sanitizing and preventing the spread. And that's at home, in the workplace, in society. We've been certainly making that message clear. And I think the industry has really worked hard with government, with organized labor to save lives and save livelihoods. And we're going to continue in this business unusual environment because this is excuse me, this is no longer a post-COVID sort of period. We believe that this is the new normal and we need to manage this new normal. But DG, Chairperson, let me stop there and obviously ask honourable members to pose their questions, and we'll try our best to answer them. Honourable Chair, back to you. Thank you. Honourable Chair, thanks very much, and back to you. Thank you.
Okay, thank you. Thank you, MINCOSA. Honorable members, because we've got the report in front of us, thank you. You came exactly on time. By the way, it's business. Every time counts. Okay, DG, can we get your presentation, and then honorable members will take notes. We will deal with the reports simultaneously. We won't start with the one other at the expense of the other.
Thank you very much, Honorable Chair. Greetings to yourself and also to honorable members, the CEO of the Minerals Council, and also all the DPGs and chief directors.
You are disappearing with your voice, DG. I don't know whether it's only me who's.
Is it? Okay, thank you very much.
Now I hear you, and I hope others also is the same.
Okay, no, thank you very much, Honorable Chair. Greetings to you, Chair, and honorable members, the CEO of the Minerals Council, and also his executive management team, all the DDGs, and our chief directors that are in this call, the support staff to Parliament and Ministry, and all the colleagues from the department that are in this call. Thank you very much, Honorable Chair and honorable members, for affording us this opportunity to come and give you an update of the work that we have been doing and that we continue to do as the department in regard with COVID-19. As the regulator, we know that we have a huge responsibility bestowed upon our shoulders in making sure that there is a compliance with the regulations, working together with all the social partners within the mining industry. Honorable Chair, I just want to highlight a few points before I hand over to the team. Mr. Msiza will come in together with DDG of Corporate Services from the department. The presentation that we have submitted to honorable members earlier on, the content is still the same, but we felt that after looking at it, maybe it would need to be enhanced a little bit with some further information, doing some comparison and analysis. And after that, we have also looked at our entities as well that perhaps we need to give members a bit of a brief synopsis in regard with our entities. We are very much mindful of the fact that this is not a quarterly reporting session, but we felt that because we are talking about COVID-19 compliance and the role of the regulator, and so maybe just very briefly, if we can also give you a brief synopsis of what we are doing. And so, Honorable Chair, in terms of the presentation outline, we will start with the introduction, and Mr. Msiza would come in there. Now, I would also talk into issues relating to the management of COVID within the department. And the other issue that we also look into is the DMRE COVID-19 interventions. Now here, as Mr. Roger Baxter, the CEO of the Minerals Council, has made a reference in terms of the collaborative effort that we are having as the government, in particular the Department of Mineral Resources and Energy, working together with the Minerals Council, including our organized labor within the mining industry. We'd also look at the legislative framework, what we have been doing as the department, as the regulator in this regard. The other point that we'd also look into, as you know, that the Mine Health and Safety Inspectorate have got the responsibility of making sure that there is a full compliance where there are challenges, those engagements between the council and the Chief Inspector of Mines. And so give a high-level update in terms of monitoring of COVID-19 compliance. We'd also touch on the instructions issued in terms of legal provisions. And also, lastly, will be the stats. I think Dr. Balfour also reflected on this point. We'll just cover it at the high level. And then from there, it will be a closure. And so, without any waste of time, Chair, perhaps what I would actually do now, I would invite the Chief, the DDG Corporate Services to come in. Then I'll come in as well during the presentation, just to highlight a few issues. Maybe, Chair, let me just deal with the introduction quickly without any waste of time before I invite the DDG to come in. We would all remember that the COVID-19 pandemic is resulting in a very serious impact it is impacting seriously on societies. I think I'm on slide number 3. And we are looking at also the impact to our economies and industries across the world. And now we know that, this has been having a very negative impact. We would also remember that the President of South Africa announced the adjusted alert level 3, for which regulations were gazetted on the 29th of December 2020. And as a department, we were, hard at work. As you know that since we started, we have been working very hard. And now the department continued to collaborate with the mining sector to ensure that there is compliance with COVID-19 legislation, the directions that have been issued, as well as, we also have guidelines over and above the regulations. Now, looking at the management of COVID-19 at DMRE, in response to COVID-19 pandemic in the department, we also looked at the following interventions: the establishment of the steering committee. Now, we know that you can't do this alone without involving other stakeholders. And so we have to make sure that the organized labor is also engaged in this process. And we had to comply with all the guidelines coming from DPSA. And so also the appointment of the compliance officer. Now we had also to ensure that risk assessments were conducted at all our offices, and also screening of employees and visitors entering all entrances of the department. Now this, happens on daily basis. And this service, it is also extended to our regional offices, as we know that they are dealing with our people just right where the service delivery, matters the most. We have also appointed our regional managers as well as our risk officers and, or champions. Now, the issue of the provision of PPEs to all employees, that will be the face masks and also hand sanitizers. And I can also confirm that, that we have been able to manage this process very well of the procurement of PPEs. Now, when you look also at the issue of physical distancing, we are also complying. We are saying that at least 1 meter or more according to the national recommendations. We have also come up with a provision of non-essential travels, and we are doing very well in this regard. COVID-19 awareness and communication through SMSs, emails, and notice boards. We are also looking into that. We are implementing it as well. Now, we also have a program in the department, Employee Assistance Program. It's also in place to support employees that are impacted by COVID. Now, in regard with a return to work protocol document, it is also in place as well, including, that it had to be in line with the COVID-19 directives. A risk-based staggered approach to resuming of work is also followed. It's a hybrid model that we are implementing in line with the DPSA circular. That is 50%. Now, Honorable Chair, here we are giving a picture that is now on the DMRE COVID-19 stats. We are just giving a high-level overview in terms of the total number of cases that we are having within our department, looking at regional offices as well. Now, just give you the summary. I think the information is there, is self-explanatory. Now, in terms of the total number of confirmed positive cases, we have 91 in total for the department, inclusive of all our regions. Now, number of active cases at the moment, we have 7. And number of recoveries, we have 82. And people that are on quarantine, we don't have any officials that are under quarantine. And we also report that to date, we have experienced 3 deaths. Now, also, Chair, without getting into details, the same with our entities, as we can see there, the reported cases under MINTEC, we have 31, and we have the recoveries, we have 25. And under CGS as well, we have reported cases, 27. And we have 27 that has been able to recover to date. We don't have any fatalities. And also under the regulator as well, without getting into details, Chair, I think the information is there. It is self-explanatory, as you can see that with the entities under DMR, we don't have, except a few entities that I'll reflect on. The ones that we're having now in this screen, we can see that we don't have any fatalities there. But moving to the next slide, under CEF Group Chair, regrettably so, we have 5 fatalities. As you can see, the total number of reported cases. We have also actually tried to make a distinction between the cases that are home-related and those that are work-related. Now, when you look at NEXA as well, we only have 1 fatality at NEXA. NTP, we have 2 fatalities with a total number of 36 reported cases. And also with Pelchem, we have 30, and we don't have any fatality under Pelchem. Still under NERSA, we have 6 cases with no fatalities, 100% recovered. That is the NERSA itself. Now, we also have NNR, the total number of reported cases, we have 9. 8 has been able to recover, and we don't have any fatality. And so that is just a brief synopsis in terms of what is the situation within our entities, Honorable Chair, in relation with COVID-19. Now, Chair, I think it will be now at this point that I would like to invite Mr. Msiza to now take us through the rest of the presentation. Then I'll come in at the end. Thank you very much, Honorable Chair and Honorable Members. Over to you, Mr. Msiza.
Thank you, DG, and good morning, Honorable Chairperson, honorable members and colleagues. Indeed, as the Chairperson has indicated earlier on, COVID had a immeasurable impact on all of us, including the colleagues, as the DG has been highlighted. And we've been working together as a sector and also as government to make sure that there are appropriate measures put in place, as Mr. Baxter spoke earlier. Our main collaborations has been through the Department of Health, not only at national but also in provincial level through the respective structures as well. You recall when he came and presented, honorable members, we've indicated that we've also been attending the command councils in the provinces, including the Northwest, and we've been engaging in the Gauteng, including the Limpopo and the other areas, so that we, as government, we can come up with appropriate measures together in the mining, also in the mining space. We have also engaged with NIO. We continuously, in fact, engage with NIO, the National Institute of Occupational Health, because they guide us in terms of their expertise on what should we be focusing on, specifically in mining, so that we align ourselves with the Department of Health guidelines and also the World Health Organization guidelines. We've also been collaborating with the Department of Employment and Labor on labor-related issues, including the legislation. Especially when we were coming up with our guidelines, we were really collaborating with them to assist us and make inputs. We've worked together with organized labor, as I indicated earlier, and employers as well. We've worked with MINCOSA and the other organizations that are in the sector. And we've done that well through the Mine Health and Safety